Hi everyone, my name is Riteja and today I'm here with Dr. Geeta Kutty.
Hi.
And she's going to be talking about her experience in medicine and she's going to give us some pieces of advice for us that relate to the field of medicine. So thank you so much, Dr. Kutty, for
It's a pleasure.
agreeing to do this. So we're going to go right into it. So Dr. Kutty, do you want to tell the viewers what you do and your specialty?
Sure. So I'm a gastroenterologist. I take care of the GI tract, which basically is a bunch of organs, unlike what many people out there think about a gastroenterologist. It starts all the way from the mouth all the way up to the bottom. So your food pipes, your stomach, small intestine, large intestine, and some of the other organs that are actually connected to these organs, like your liver, your gallbladder, as well as your pancreas. So gastroenterologists take care of all these organs. And so I am a gastroenterologist with advanced gastroenterology training. So we not only do endoscopies and colonoscopies, but we also tend to do advanced procedures like ERCP, where we can kind of take care of problems that happen inside the gallbladder and pancreas.
Mm-hmm.
Yeah.
So anything that relates to like the pipe part of your body.
That's right.
You take care of.
Mm-hmm.
Wow,
Yeah.
that's really cool. So, Dr. Kutty, why did you choose medicine as your career path, and like, is there any story behind it?
Actually, yeah, it's the same story that I had used for my residency application, and it's very true. Back in 1994, when I was in India and I was 9 years old, just like the COVID pandemic that we had in 2000, we had a pulmonic plague pandemic that happened in Surat. And unlike COVID, where the death rate is about 1 to 4%, the plague has a death rate of nearly 80-90%.
Wow.
So you can imagine what must have happened to a city called Surat, where I lived. The entire city got quarantined, and I was just 9 years old. I could see what was happening during this epidemic. And how kind of, the medical fraternity, including doctors, kind of rose to the occasion and were able to save so many lives. So at that young age, I think this profession had made a very big impression in my mind. And I, since then, wanted to be part of this profession. And who knew, 25 years later, during the COVID pandemic, I would get a chance to kind of give back to the community the way I had experienced back in my childhood. So I think that was the biggest incident that pushed me towards medicine.
Wow, that's a really inspiring story.
Yeah.
Yeah.
So, I mean, there are so many kids out there today who've kind of seen what COVID has done to our community. Mm-hmm. Over the last 3 years, they probably saw, if not suffered from COVID themselves. I think most of the kids out there now probably feel the need to know about medicine a little bit more. So I'm very happy that you're kind of taking this up and asking more doctors about their experiences.
Mm-hmm. Yeah. And also on that note, like, I thought COVID was like super, super devastating, like really dangerous, but that's only 1 to 4% death rate. And you're talking about like an epidemic that's like 80 to 90%. That's very crazy.
That was very crazy. And it was, I think it did cause a very big mortality in the city. But thanks to, the doctors, the nurses, and the medical field, the city was able to be quarantined in time to be able to contain the epidemic. But this was nearly like 30 years ago, mm-hmm. where we did not have internet, very few supply of tetracycline, which was used to kind of treat this disease, and almost every city ran out of this medication. So compared to that, I think COVID, we were able to manage much better. Again, thanks to the advent in medicine, and it's therefore I feel like medicine needs to keep evolving as time goes, so that we can take care of bigger pandemics, which I think will happen in the future.
Mm-hmm. So, Dr. Kutty, why did you choose gastroenterology as? Wait, am I saying it correctly?
Yes, you are. Gastroenterology. Just say GI.
Okay, GI.
Yeah. So why did I choose GI?
Yeah, so why did you choose GI as your career path? Like, out of all the specialties, why did that stand out to you?
Yeah, so, I think a couple of things will always make you think about going into a certain specialty. for example, personal experiences, right? So if you've had a problem with your GI tract, that's more likely that you're actually going to choose this field. So that's kind of the case for me as a child. I always had GI issues, and I remember my dad taking me from one doctor to the other. So I really do, I guess, empathize in a true sense with patients who have GI diseases. But on the other hand, also, you have to think about whether you are somebody who likes to talk to people, right? If you do not like to talk to people, then you probably want to go into a specialty like radiology or pathology or microbiology, where you are not going to have that face-to-face interaction. For me, I love to have that face-to-face interaction, but at the same time, I like to work with my hands. So GI, I think, is one of those amazing fields that sort of is at the cusp of medicine as well as surgery. So you get to think like an internist, like your mom, but at the same time, you get to do surgeries like a surgeon does. GI, has so many procedures. You can do an endoscopy, which looks at the upper GI tract. You can do a colonoscopy that looks into the colon. But at the same time, as I said, we are not confined to just those organs, right? So there is endoscopic ultrasound, where you can use a scope, go inside the GI tract, and then basically push that probe against any organ in your body and send ultrasound waves and look at that organ. So you're not confining yourself to just the GI tract anymore. ERCP, which is a procedure by which you can go into the bile duct, again, remove stones, save lives. But not only that, now what's happening is GI is doing something called as NOTE procedure. Earlier when you had to remove gallbladder, you'd have to basically make a small cut on your belly and then kind of remove the infected gallbladder. You do not need to do that anymore. You can just pass a scope through the mouth into the stomach, make a small cut on the stomach, go through the stomach into the gallbladder, remove the gallbladder, stitch up the stomach, and then take the gallbladder out of the mouth. Wow. So there will be absolutely no incision on your body or any cut on your body that needs to heal. So these are the advancements that's happening in the field of gastroenterology, making it some of the most exciting subspecialties to be in, especially if you have a surgical inclination. Mm-hmm. Yeah.
Wow, yeah. There's like so much more to this field than I thought there was.
Yes.
Because, yeah, I know, like I never ever thought of like those probes, and then that's actually like really like super cool. Like,
yeah. So I think, the other thing that makes GI super interesting is, first of all, you're taking care of at least 7 different organs, unlike, cardiology, for example, which is equally surgical and medical. You have both the thinking aspect as well as the doing aspect with your hand, but it's confined to a single organ. Pulmonary critical care, again, confined to a single organ of lung. But GI, I feel, is for people who can get bored with just one organ. So you have a lot more organs to take care of, a lot more pathophysiology to take care of. And then if you feel like you want to subspecialize in gastroenterology, I think it has some of the more varieties that subspecialties can offer. For example, you can become a transplant hepatologist, where you can help patients with, livers that don't work anymore. You can help transplant them. You can do inflammatory bowel disease subspecialty, where you're basically taking care of immune-based diseases that affect the GI tract. You can do advanced GI for the stuff that I just talked to you about, like, ERCP, EUS, and procedures where you can remove gallbladders, like NOTES procedure, etc., without any incision on the body. There's also specialties where you can do just motility, try to understand how your organs move, nutrition. So the subspecialties in GI are just growing because of a number of organs that are involved in the first place. On top of that, we also know now that your GI tract has billions and billions of bacteria, right? And so that bacteria itself is such a vast research topic right now, because that bacteria has been associated as being the seat of your immune system. So now you have this interjection where GI tract is meeting your immune system. So we are trying to manipulate that bacteria to kind of understand if we can, heal certain autoimmune diseases or even prevent Parkinson's disease. So there are a lot of things that are very, very evolving and at cutting edge when it comes to research in GI as well.
So the future is like very bright for gastroenterology, it seems.
I believe so. Yes,
Yeah.
yes.
That's so. What do you work with? Are you like just the general gastroenterologist? Or?
Yeah, so I do general gastroenterology and I do ERCPs. So I take care of the, the luminal GI, which is just the GI tract, as well as do certain procedures that are meant to be done for the pancreas and the biliary tract. Yeah.
Wow, that's interesting. So, Dr. Kutty, take me through like a day in the life of you. So, what do you do morning to night as a gastroenterologist?
Yeah, so, even in the field of gastroenterology and practice of gastroenterology, things are very different. So, you can choose whether you want to concentrate more on hospital GI, which is more acute, versus outpatient GI, which is more chronic, or have like a good mix of both. Well, I have chosen to have a good mix of both. So depending on whether I'm on call at the hospital or at the clinic, my day can start as early as, 7 in the morning, go all the way up to 5 or 6 in the evening. But when you're on call at the hospital, as you already know, you are on call 24/7. So whenever an emergency comes through, you have to go, whether it's 2 a.m. or 2 p.m. You're on call. But when you're on call, you cannot get out of the clinic work that you have been assigned because patients have already been scheduled. You have your routine procedures, so you can have a half day of clinic where you see about 10 to 12 patients, and then another half day of procedures where we're doing about 10 procedures. So it's a good mix of all of them. If you're just confining yourself to outpatient practice, though, it's a pretty easy, maybe 8 to 5 kind of job. Doesn't require you to go to the hospitals and stuff. But the hospital work is where you actually feel, there's more excitement. You're doing more life-saving work where, patients come in with a bleed, and then you can quickly do a procedure, and then 5 minutes later they're all good and ready to eat their meal and ready to go home after 10 to 12 hours. So that's a more powerful aspects of GI is kind of more evident in the hospital setting, but not to minimize that it's not as powerful in the clinic. But in the clinic, when you're taking care of patients, you do intervene, but you're going to see the effect a little bit more delayed. So you get to establish that relationship with your patient for that long-term care that you're going to provide for them. Okay?
Wow, that's really interesting. The difference between the clinic and the hospital it's different. Yeah. So I guess that makes it good for you because since you have a mix, you still have time to like take care of your kids and yeah. So.
Yes. So the good thing about GI is it's your choice whether you want to be at the hospital or not. If you want to make it more of a lifestyle branch, you just stick to outpatient practice. And I think that's what's happening now. There's so much volume for just doing, screening colonoscopies or taking care of patients who have precancerous conditions in their gut, that there's a lot more GI workforce that is required in the outpatient practice. And so more and more hospitals are kind of just employing gastroenterologists to take care of the hospital aspect of GI, which is, again, more acute, more emergent, and we need the gastroenterologist to be there when we are calling them. So if you want to choose GI, it does offer both those lifestyles. When you don't have kids and you want more excitement and you want to do, more work that's intensely gratifying and quick, then you can go into the hospital. But once you have kids and you want to take a step back, take care of them, maybe drop them to the school and pick them up, that's also totally possible with the outpatient practice.
Wow, yeah.
Yeah.
I guess it's good that like, even though people associate doctors with like working so hard, like now there's an avenue where, you can still be with your family, but also like do the life-saving work that doctors do.
Yes, you can, Sri Teja. But this has to be taken with a pinch of salt because to get to become a gastroenterologist, you have to work your way into your, I'm presuming your mid-30s at least, right? And so There are certain sacrifices. For example, you're not going to have that lifestyle when you're in med school or during residency or during fellowship. You may get that lifestyle once you get into practice. Yeah. So mid-30s is when now a lot of people in medicine choose to have kids. But if you have them earlier, which many of us choose to have kids earlier, you may have to miss out on those aspects of being able to drop them off or pick them up because you're in a very intense fellowship. So those are certain realities of subspecialization, because it does require 3 or 4 additional years out of your life. Yes.
Yeah. So like touching on that point, how many years does it take to actually become a GI doctor? And
Yeah. So let's say if you want to become just a general gastroenterologist, it would take 6 years more after finishing your med school. So, and that's if you go straight.
For the viewers, so for the viewers that don't know, you need 4 years of undergraduate, right? And then 4 years of med school.
That's right.
And then you can go into like whatever specialties, right?
Right. So 4 years of med school, and then you go into residency. And so clearly, if you want to become a gastroenterologist, you're going to do 3 years of internal medicine, and then another 3 years of gastroenterology. And that is if you get into fellowship of your choice immediately. If you don't, then you are going to be doing research or some other work like hospitalist work or primary care work while you keep applying for the specialty.
Yeah. So like moving away from that point, Dr. Kutty, what is the most satisfying part of your job?
Oh, there's so many satisfying part about my job. So as I said, to get that intense gratification that makes you feel like almost godlike, go to the hospital. Save some lives. When patients come in with a GI bleed and you do a procedure and you take care of that bleeding ulcer and the patient's doing better the next day, that's very gratifying. And the patients, they definitely show their gratitude. That's, I think, the most important part for me to even get into medicine. Do not get into it for money. As we all already know, that's not why you should be going into medicine. You're probably better off with other branches to be making money. The other gratifying part about gastroenterology is because you have that outpatient aspect, you have patients that have been under your care for years and years, and they almost become like an extended family to you. They see you every couple of months. They even tell you like, how are your kids doing? You know their kids by name. So you just feel like you're part of a community now, and that you're really meaningfully contributing to your community, which really makes your life much more fulfilling. Yeah. Yeah.
So like not only do you save their lives, you also get involved with their daily life.
Absolutely. Yeah. And your patients are kind of so sweet. It's not needed that they do these things, but they feel close to you. And they bring, tiny things like homegrown tomatoes. Like, we can all buy tomatoes, but it's those tiny little things that makes you feel like at the top of the world, right? That cannot come in getting like, $10,000 extra from somewhere.
Yeah.
But those tomatoes or that little gift that they bring with so much love, that makes it totally worth all the work that you've put in for becoming a gastroenterologist. Yeah.
So those little things are way more heartwarming
yes,
than
they
like
are. They
that
are.
extra bonus or whatever.
Yes,
so
absolutely.
Totally makes sense.
Yes,
Yeah.
it makes you smile.
Yeah.
Yes.
So like going on the opposite end of the spectrum here, Dr. Kutty, what are the most like challenging aspects of your job?
So I think I should start from getting to the job, right? So to get into becoming a gastroenterologist, you do have to sacrifice some part of your life that you would have wanted to be more involved. For example, like I had my kids when I was in my residency and my fellowship, so I know that those things that you just said, right? Spending time with them, being able to take them to school, being there when they had their winter, festival or dance, etc. I was not there for some of them, and I definitely do make intense efforts to be able to be there for them right now. But yes, you have to understand that the training is long, and so you have to be able to let go of some of these things as part of the training. Secondly, once you're in training, you do have to realize that even though you may be very talented, it might be tough to get into certain subspecialties because of the intense competition. Thirdly, once you get into GI, there is always, politics, right? So you will have to deal with a lot of people who have different perspectives on how to run medicine. Medicine has now become sort of like a business, right? So you might be going in there completely with that naive, I want to help patients kind of attitude. But now medicine is also controlled by the business aspect, which is what are your revenues, how are your profits being generated, what is the loss, etc. And this all also has to do with reimbursements that come from your insurance, right? So insurance has been decreasing the reimbursement as years have gone by. And so keeping up the practice of medicine has become tougher and tougher for doctors and for many other private practices. So you do have to understand that there's a lot of business that you will have to learn to be able to sustain your practice. You have to negotiate with insurance companies, which you would have never thought you would have to do, but you do have to do all those things. You have to change your medical practice, see more number of patients to be able to generate more income so that you can pay your staff. So the business aspect of medicine is not something that I was very well versed with. And I can only, imagine that more and more medical students need to be aware of this business aspect before coming into medicine. Mm-hmm. Yeah, so that is a big challenge. Secondly, patients that you're taking care of. For example, I have a patient who has Crohn's disease and is on a particular medication, has been doing great with that medication. But then suddenly their insurance changes, right? And now the new insurance is not going to give them this medicine anymore, which is really life-saving for them. So you have to go through a lot of, again, negotiation with the insurance. Sometimes you may have to give them a medication that may not be the best, absolute best medication for them, to maybe like a tier 2 medication that the patient may benefit from, and they have to go through the entire rounds of taking the medication that is new to them again. But you have no choice because that's what their new insurance will approve. So there are a lot of things to do with insurance, reimbursements, cost of a medical practice that we need to be aware of. Mm-hmm. Yeah, and those are definitely challenging.
Mm-hmm. So yeah, definitely financial aspects are also another part of medicine that you cannot ignore. So
no, you cannot ignore that anymore. Mm-hmm. And I think the solution is now that more and more practices are consolidating with each other so that they can share cost and they can have a bigger say when it comes to negotiating with insurance companies. But as a solo practitioner, it's going to be much, much tougher now.
Mm-hmm. Yeah, that makes sense. And also on your first point, like being a doctor and then returning to your life is not really possible because once you become a doctor, that is your life. So
yes, so so that is a very big aspect. Being a doctor means you are always going to be responsible for your patient's disease, and whenever something goes wrong, you are the person that they're going to contact. So whether you're on vacation, after you come back home, it doesn't matter. You will be taking care of them. The good thing is if you are in a group practice and somebody that you really trust can take care of your patients while you're away. But I have seen plenty of doctors who've themselves, not feeling well, have fever, but they still go and take care of their patients before they themselves come home and rest. Mm-hmm. Doctors who lost somebody in their family and they have to urgently take a flight to India, but they will finish their procedures for the day and then take the flight for India, not because they want to do those procedures, but they understand that their patients are going to suffer otherwise. Mm-hmm. So there's a lot more on the plate when it comes to taking a decision for yourself. You have to consider a lot of other things as mm-hmm. well. Yeah.
Yeah, that makes a lot of sense. Yeah. So Dr. Kutty, summing up all of this, is there any pieces of advice that you would give to any aspiring people who want to be in gastroenterology or who are just interested in medicine like me? Do you have any pieces of advice?
Yes. So for the newer, generation, I feel like you guys are so smart. You have so much exposure to technology. that, some of these things when I came into medicine, especially the business aspect of it, the artificial intelligence aspect of it is also new. But you're going to be, growing up seeing all of this. So making yourself aware of the business aspect of medicine, using AI to better help you to take care of patients, these are all here to assist you. You should make the choice of going into medicine because you feel passionate about it. The money will follow when you are passionate about something and you give your best to doing that. But do not go into it for the money or the prestige, because the time that you're going to spend trying to become a good doctor, and then the challenges that you're going to face once you become a doctor, it's a never-ending learning curve, right? So you're gonna have to, learn all of those things. And I think that you guys are, well equipped to do that, but do be cognizant of these aspects of medicine that may not be taught in the medical school per se when you go into it. Yeah,
definitely. Yeah, that makes a lot of sense. Yeah. So. Is there any specific piece of advice, like in gastroenterology, you would give to other people who are considering that subspecialty?
For GI,
yeah.
I totally say this is the coolest, and I'm biased, obviously, but I think this is the coolest subspecialty in internal medicine, and it is a subspecialty that is almost surgical. So if you have a passion for cutting edge technology to be used in a medical practice and like to work with your hands, this is the best specialty that you can be in. Also, I think gastroenterologists have a great sense of humor, so it's nice to work with people who can talk about poop, right? Because you have to be used to talking to patients about it. You are also, somebody that a lot of people will have questions to ask, especially when you go to a party, because everybody has gut-related problem, everybody has gas, bloating, so you will always be asked questions by random people wherever you go. And if you don't mind those things, you should definitely go into GI.
Yeah, that's really funny, yeah, but it's also super, super interesting.
Yeah.
So Dr. Kutty, another question that's like kind of a fun question, like if you hadn't pursued medicine, is there a career that you wanted to go into?
I think other than biology, I really liked English and arts. I would have probably chosen something in theatricals, drama, dance, arts, painting, something to do with my hand, but at the same time communicating with people. So I think that would have been my other choice.
Yeah, and while you were describing it, like even though like English, drama, literature, all that is different from being a doctor, you still described like the same commonalities, like working with your hands, talking to people. So I think that's really interesting.
Yeah. So it's very important because you really need to love talking to people, because when you go into medicine or GI, you're going to be talking to one patient every 10 to 15 minutes, right? So if the aspect of, clearly explaining to the patient and making that genuine connection with them, if you're not able to do that, then they're not going to trust your judgment or trust the treatment that you're going to talk to them about and want them to follow. So I think it's very important to be able to establish that connection right away if you can. So I guess that's the aspect of drama. If you like to do that, if you like to convince your audience of what you think, then I think that's a useful aspect in GI as well.
Yeah. That's super cool. Yeah. Okay, so Dr. Kutty, like you talked about this, like gut bacteria is such like a hot topic right now, and it's such like a booming industry. Many companies are addressing this with many different products. So as a doctor yourself who works with that, do you have any advice on it, and like any lifestyle choices or anything like that you have to say on it?
So, we know now that the gut bacteria gets established at a very young age. In fact, the very aspect whether a baby was born by C-section or by vaginal delivery itself is the stage for your bacteria, how your bacteria is going to be, or what kind of bacteria that baby is going to have. And once that bacteria is established, so there are certain bacteria called the gatekeeper bacteria. So those bacteria will decide what kind of other bacteria can stay within the intestine and what cannot, right? And those gatekeeper bacteria can change with exposure to antibiotics, stress, wrong eating habits, etc. So what my advice is going to be is right from the get-go, starting from the choice to whether have a C-section versus a vaginal delivery. Better to go for vaginal delivery. Avoid antibiotics, especially during young age when the kid has all the good bacteria. Try to avoid processed food. We all know now that the processed food is probably one of the worst things you can do for your gut bacteria. And the reason is all the additives that the processed food has, such as guar gum, xanthan gum, and many other emulsifying agents, they really cause the gut bacteria to be either lost or change over time. So eating natural food such as raw vegetables, fruits, fermented food, like that happens in almost every culture, right? For example, in the Indian culture, we have a lot of fermented food like dosha or idli or pickles. These are all fermented food that we eat on a daily basis. It's the same thing in Chinese culture or Asian culture to have kimchi, etc. So fermented food are natural sources of really good bacteria. So there's no need to take probiotics that are sort of marketed out there, because we haven't really studied if these probiotics can stick to the gut. But just having like good natural food, fermented food, plenty of fiber, because fiber also helps to kind of keep the bacteria, the good bacteria within the gut. And these fibers, again, come from fresh fruits and vegetables. As far as, avoiding risks for colon cancer, should definitely avoid processed meat. If you are somebody who eats non-vegetarian food, it's better to have fresh food that is actually cooked at home rather than having processed food. So those are just simple, techniques that we can use to help with our gut. Turmeric, that's also something we already know has a big anti-inflammatory property. And again, in many cultures, it's very normal to have turmeric in your daily meals. We all now know how turmeric can actually help patients with ulcerative colitis, even like it's been proven that curcumin, which is an extract from turmeric, can act as well as mesalamine, which is a treatment for ulcerative colitis. So lots of superfoods out there that you can include in your diet, but just having vegetables, fruits, and fermented food with tons of fiber is a great start.
So Dr. Kutty, the final question that I have to ask, we kind of touched about this a little bit before, but like both of us know that like AI, machine learning, artificial intelligence is such a booming industry right now, and lots of people are talking about influences in the medical scene and potentially like replacing doctors, replacing jobs. So what do you have to say about that and like basically the picture of AI in the medical space and even in your specialty, even in GI?
So that's a very good question. I think whenever new technology comes in, as human beings, our first reaction to it is fear, right? So when the internet came, people thought, oh, it's going to destroy, I think it's mostly to do with all the movies that America has been making about robots. But I do not think we need to be afraid of AI. What is AI? It's just technology, right? And technology has only helped in medicine. All the medications that we take, they are all product of technology. So I think AI is going to only help physicians become more efficient and actually help to reduce human error. We are all human beings. We are bound to make mistakes, especially when we are burnt out, especially when you have a pandemic and you're taking care of hundreds of patients at the same time, right? So if AI can help us to make better decisions for our patients, then why not? Well, specifically speaking in my subspecialty GI, I can give you just an example here. There is AI that we use in just screening colonoscopies, right? So let's say an average gastroenterologist is able to detect, 25 polyps. Now, polyps are precancerous growth inside the colon that can become cancer in the future. And as you know, colon cancer is the second leading cancer that kills people throughout the world. We already know that AI-based endoscopes can actually detect 20% more precancerous polyps and be able to tell the physician that there is something happening over there and you need to take care of it, which can easily be missed by, a physician's eyes. So you are talking about something as simple as that, kind of disrupting our understanding of how to even look for polyps, right? And if AI can help us in these things and reduce the mortality that is associated with colon cancer, then why not? In fact, we are also seeing that AI is helping patients with precancerous lesions in the stomach, in the food pipe. It's looking at patients who can come in with like a flare of certain diseases like ulcerative colitis or Crohn's disease. It can predict the risk of these patients having a flare in the future, and therefore it can tell physicians to choose certain kind of medications over others. So the predictability of certain disease patterns is so much better with artificial intelligence that I feel like it's only going to assist and make the doctor's job much, much easier. But at the end of the day, these are data points that are coming from artificial intelligence. You still need a doctor or a gastroenterologist to take that information, put it in the right context, and be able to take the right treatment or choose the right treatment for the patients. I do not think it's going to replace a doctor yet. Will that happen in the future? It may, but I do not think we need to be threatened by, AI. At some point, I guess we are all replaceable.
Yeah, that's definitely something to think about. But I like how you approached like this whole artificial intelligence scene as not like a fear, but rather something that can help you and as a tool that can aid you in your practice while instead of just like fearing about like replacing your job. So that's really interesting. Yeah.
I think fear is basically, whenever something that is unknown is presented to human beings, fear is the first reaction. So I think we need to let go of that, kind of a very primordial emotion and look at things from the perspective of the patient, right? If you were the patient and you were going to a doctor, and if a doctor with AI is going to probably do a much better job of detecting something and treating something, then I would choose that doctor.
Yeah, that's super interesting, super cool, and that basically concludes our interview. So thank you so much, Dr. Kutty, for doing this interview. I learned a lot, and I know you gave such amazing pieces of advice, so thank you so much for that.
You're so welcome, Shriteja. It was an honor to be here. Thank you.
Thank you so much. Yeah, and comment down below the biggest thing that you've learned, because again, I've learned so much from this interview and about gastroenterology in general. So thank you so much for watching. Make sure to like, comment, and subscribe. Do all that. And yeah, we'll see you next time. Bye.